For what purpose does the gentleman from Illinois seek recognition?
Madam Speaker, I have an amendment at the desk.
The clerk will report the amendment.
Amendment offered by Mr. Schock of Illinois. Page 28, line 23, insert after the dollar amount the following: reduced by $16 million, increased by $16 million.
Gentleman from Illinois is recognized for 5 minutes.
Thank you, Madam Speaker. First, let me say thank you to my good friend from the great state of Washington for his cooperation in allowing me to offer this amendment at this time. This amendment specifically dedicates $16 million within the Office of Rural Health to expand the current rural veterans' access to covered health services through qualifying non-VA health care providers to a new area within each VISN they currently operate and new VISNs altogether. This came about in talking to veterans who live, in many cases, hours away from the qualified VA facility and expands a very popular program within the VA that allows these veterans who are in need of health services to visit an approved health care provider closer to them, limiting their cost, the time and travel required to get their needed benefits. At this time, I'd like to yield 3 minutes to my friend from Illinois, Congressman Schilling, who's been working tirelessly on this effort of expanding health care for rural veterans.
Gentleman may not yield blocks of time, but gentleman from Illinois is recognized.
Thank you, Madam Speaker. I believe in the concept of allowing our veterans to receive medical care closer to home. I remember taking care of my dad during his last few months of his life and driving him back and forth from Iowa City hospitals several hours at a time for my dad to get the care he needed. While we appreciated the service and the care provided through the VA, I believe that we must continue to make improvements to the care our veterans receive. I've talked to many constituents in the Illinois 17th District who feel the same way. In 2008, a law was passed that created a pilot program called Access Received Closer to Home, also known as Project Arch. This program helps veterans who are more than 60 minutes away from the nearest VA health care facility to receive primary care for services at non-VA health centers that contract with the VA. I believe this is a very promising program for our veterans, and this amendment would allow Project Arch to serve more veterans, and here's how. A 2011 audit of the Office of Rural Health found that at the end of fiscal year 2010, the Office of Rural Health had obligated $16 million of its budget. The audit went on to find examples of lapsed funding that, quote, constituted missed opportunities for the offices of rural health to improve access and quality of the care to rural veterans, end quote. This amendment would help turn these missed opportunities into more veterans served. This amendment by Representative Schock and myself would take unused and unobligated funds from the Office of Rural Health and devote this money to Project Arch so that it can be served for more of our veterans. I support Project Arch's goals of improving access for veterans in cost-effective ways and improving easing travel requirements and the care that our service members receive. I also support another program similar to Project Arch. In 2006, Congress directed the Veterans Health Administration to implement a contracting pilot program to better manage the fee and basis care program that the VA runs for veterans seeking care outside the VA system. That project is called Project Hero. The VA has stated that Project Hero has resulted in annual savings of $16 million in 4 VISNs. It operates in less than 20% of potential workload. This means that the savings figure will be much higher if Project Hero is utilized across all of the VISNs and at a higher workload level. That is why I believe that we should support this program and provide it funding so it can help more veterans who do not have easy access to the facilities across the United States of America. With that, I yield back.
Yields back.
With that, I would just say I urge my colleagues to support this amendment to increase funding for rural health care. I yield back.
The gentleman from Illinois yields back. Member seek time in opposition. The question is on the amendment. The gentleman from Illinois. All those in favor say aye. All those opposed say no. Opinion of the chair, the ayes have it. The amendment is agreed to.